I'm Dr. Karnik. I'm a pediatric neurologist practicing for almost 40 years. I see children and adults for various conditions, but for the last 5 or 10 years, I have restricted my practice to ADHD, autism, and cognitive disorder of children and adults. As a result, I see literally hundreds and thousands of patients with this condition. So I'm going to put my thoughts for ADHD today in this little video. ADHD is about 5 to 9%, which means if you have 10 children in a class, there'll be about one child in that particular class. So it is a common condition. It is seen in boys and girls, adults, both women and men, but primarily it is seen in boys. Roughly 5 to 1 times boys to girl ratio. Now, many children outgrow it, but some, about 25% or so, continue to have this problem as they get into adult age. And the symptoms may change, but the problems will continue. So it is a problem that goes on for quite a long time. And therefore, proper diagnosis and management is very essential. And that's what we do in my clinic. Now, with regards to symptoms, when you suspect ADHD, there are a few symptoms that are very important. There are 3 things that you will see in patients with ADHD. Number 1, they have problem with attention. Obviously, it's attention deficit. They also have sometimes impulsivity, and impulsivity means they will do things when they're not supposed to do certain things. And the third thing is some patient may have hyperactivity and they'll have problems sitting at one place for an extended period of time. Now, all these 3 symptoms are not always present in children with ADHD. They may have predominant attention problem or problem with focusing. They may have some impulsivity, and they may or may not have hyperactivity. So you have to discern very well in terms of history and observation. When it comes down to examination, most of these children are normal. The neurological exam is normal. So what we are looking for when we examine them is to make sure that they do not have some other condition that makes them look like they have ADHD. For example, they may have absence seizure or petit mal seizure, in which they will just have the seizure here and there, and therefore they're not paying attention. Some of them may have some neurological conditions. Some of them may have learning disability or dyslexia or dysgraphia or high-functioning autism. And therefore, you've got to make sure that you make appropriate diagnoses to come to a final conclusion. Now, once you make a diagnosis, you confirm that, and there are various tests available for confirmation. In my lab, we do, for example, some data analysis. They go through integration of visual and auditory attention, and we have some software programs that we put them through to come out with a proper diagnosis. I also have analysis of electrical activity of prefrontal cortex, because that's the area of brain that controls impulsivity and attention, and we can figure that out. So a very good lab can actually go into some investigations for ADHD. We also give them forms, and those forms are filled up by parents and teachers, and that gives us an idea whether the child has ADHD. We have forms for even adults, and we can find that out. So therefore, diagnosis of ADHD is not simple. It goes through a lot of process, and then you come to a conclusion that child has or does not have ADHD, or child has something else along with it, or something else and not ADHD. But that can be done by a pediatrician or a neurologist or a psychiatrist or a diagnostician. Once you make a diagnosis, they need treatment. Generally, what I recommend to almost all patients is holistic integrative approach. So find out if they have any learning disability so you can give them proper educational help at school. Many of them need behavior counseling. Many of them will need some therapies that are important to improve. If they have learning disability, they may be in dyslexia program or dysgraphia program, which means a writing program, and these are very essential. Now, the other component of holistic integrative approach is nutrients. And almost all of my patients will go on nutrient changes or addition to improve their functions. And I have seen a good significant improvement with these ingredients. They include, for example, omega-3 fatty acids, magnesium, B6 vitamin, 5-hydroxytryptamine or 5-HTP, or various other components, and we will have a separate talk on brain nutrition and what improves ADHD. As I said, many of my patients have improved significantly, and they will be only on nutrient and they may not even need medication. So this approach is very important in therapeutic mode. The next one is, of course, medications, and there are three different groups of medication that we consider. One group is a stimulant group, and under that, methylphenidate products. Now, there are so many products under methylphenidate. For example, the commonly known is Ritalin long-acting. But you also have Concerta, Metadate, and there are various other medications that have come. Now, your physician will choose appropriate medications if your child needs medication, and that can be done by somebody with great experience in that field. The other group of stimulant is amphetamine group, and a classic example of that is Adderall or Vyvanse, and these are very commonly known medications, but there are so many others available. In fact, there are at least 5 or 6 different ones that are available for any physician to treat your child, and they will select the appropriate one for you. The third group is non-stimulant, and in that there are two that are very important. One is Intuniv or guanfacine, and the second one is Strattera or atomoxetine. Now, these are not considered as line 1 or stage 1 therapy, but some children cannot take stimulant, or you put them on stimulant and they develop some side effect, and in that case you have to use non-stimulant, and they could be very useful. So for example, somebody has ADHD and tic disorder. In that condition, stimulant can be contraindication. You may not be able to use stimulant because they make it worse. In that case, these are very important. Or somebody has a lot of anxiety, then this can be very important. And again, let your physician make those decisions for your child. Now, follow-up of patient is very important, because once you give medications or any therapy, you got to make sure your child is doing well. And at that time, a regular follow-up will tell you or tell a physician that your child is doing well. The medication dose may have to be modified. Side effects need to be identified. And therefore, don't just get your child to a consultant, get treatment, and don't have follow-up. So they will always need follow-up. My experience is majority of children will do well. About 65 to 75% of children with ADHD will do well with either one of the therapy that I mentioned or all of them in combination. Prognosis generally is good. If child is smart and going to do well, you want them to do well, and ADHD should not be in the way of progress. And therefore, treating them is very important. I have children who are not doing well in school and were failing, and with proper management, they started getting straight A. I have seen children who were on medications and then they went to college and decided not to take medications, and they were thrown out of college. They went back on medications and they passed with a score very close to a perfect score. And when you see that, you realize that these children deserve proper diagnoses and management. And that's what I would highly recommend any parent or any teacher to get for their student or children. Thank you. This is again Dr. Karnik. I'm a pediatric neurologist. If you have any questions or if you need any more information, we would have it on our website, and that is brainmindbody.com. So please visit brainmindbody.com and you'll get more information on all this thing. Thank you. Have a great day.